Hello guys, so now we shall be discussing regarding the branches of the internal as well as the external iliac artery. Okay, so all of you know these important things that we have got this particular branch over here. This is called as your abdominal aorta. Okay, this abdominal aorta over here is divided into two important branches. These two are called as common iliacs. What are these two called? These two are called as common iliac arteries. These common iliac arteries are in turn divided into two important branches. One is called as your external iliac, another one is called as your internal iliac. One is called as what? Your external iliac, another one is called as your internal iliac. Now let us look at the branches of both external as well as the internal iliac. Now in this picture from the lateral side, you know this is L4, L5 and down is your sacrum. Right, so let me draw these branches one by one accordingly. So this branch is called as your common, that is your abdominal aorta. What did I tell you? Abdominal, and this is abdominal aorta will divide into common iliacs. Common iliacs will in turn divided into external and internal iliac. So let us say this is your common iliac artery. This common iliac artery is dividing into two important branches. See, this branch is called as external iliac and this branch is called as internal iliac. Okay, so what is this branch? I'm naming these branches as A, right, and B. Okay, so A here, what does A here stand for? A here stands for external iliac artery, external iliac artery, and B here stands for internal iliac artery, internal iliac artery. So one is called as your external iliac, another one is called as your internal iliac artery. Okay, now this external iliac artery will pass down all the way. Okay, so this is how it is passing. So this external iliac artery is passing down all the way like this. So this is your external iliac artery. Now this external iliac artery will continue later as another artery called femoral. All of you know that once this external iliac artery crosses the inguinal ligament, you call this artery as femoral artery. So it means this artery should be called now as femoral artery. This should be called as femoral artery. Okay, now within this external iliac gives one branch that goes back like this. So the name of this particular branch is called as deep circumflex iliac artery. What is the name? The name of this artery is deep circumflex iliac artery. This is your deep circumflex iliac artery. Next, not only that, you even see another branch that is coming out like this. So this particular branch is called as inferior epigastric artery. Okay, so this particular branch is called as inferior epigastric artery. So how many branches we have discussed so far? One is called as a femoral artery, right? Another one is called as a deep circumflex iliac artery, and the third one is called as your inferior epigastric artery. Now after this, coming on to external iliac, right? Now external iliac we are done. Now coming on to the internal iliac. What are the branches of your internal iliac artery? So if you look at the branches of the internal iliac artery, the first important thing is that this internal iliac artery is divided into two important parts. Okay, two branches. One is called anterior branch A, another one is called P for posterior branch. Anterior as well as a posterior branch. Now this particular anterior branch, whatever is there, right? So this particular anterior branch will give out few more branches. For example, this anterior branch gives out its first branch. This branch is called as umbilical artery. Okay, what is the name of this artery? The name of this artery is umbilical artery. So the name of this particular artery would be called as umbilical artery. Okay, now this umbilical artery, later on what will happen? This will become obliterated. Umbilical artery will become obliterated, and this umbilical artery will convert into a very thick ligament. Okay, and this ligament is called as medial umbilical ligament. What is this? This is called as medial umbilical ligament. Okay, this ligament over here is called as your medial umbilical ligament. So what are the important things we have got? We have got something called as umbilical artery. Umbilical artery is obliterated and it is continuing as a ligament called as medial umbilical ligament. Now from this umbilical artery, you see two other branches that are coming down. This is one branch and this is another branch. Okay, so let us name these branches as 1 as well as 2. What are these 1 and 2 branches? Branch number 1 and branch number 2. So first branch is called as superior vesical artery. Another one is called as artery to vas difference. Artery to vas difference. So superior vesical artery and artery to vas difference. This is another important artery. Okay. Now after giving these two branches, what will happen to this particular artery over here? Now this particular artery will continue down. This particular artery in the sense which branch? That is an anterior branch of external carotid artery. This anterior branch of external carotid artery is coming down all the way and it is continuing down as pudendal artery. What pudendal artery? This is internal pudendal artery. Okay, so it comes down all the way like this, right? It is coming down all the way and it is continuing as internal pudendal artery. It is continuing as what? Internal pudendal artery. Okay, now let us see what are some of the other branches which we will discuss over here. The first important thing is that this branch over here is giving one more branch that supplies onto the top like this, right? Onto the obturator membrane here. So this artery is called as obturator artery. So let us name this as artery number 3. This is called as obturator artery. The anterior branch is giving an artery called as obturator artery. Okay. Now it is also giving another artery over here. So this particular artery, let us name it as artery number 4 and this is called as uterine artery. Okay. After that it gives one more artery and this is called as vaginal artery. Artery number 5 is called as vaginal artery. And finally we have got the last artery over here. This artery over here is called as your inferior vesical artery. Okay, so artery number 6 is called as inferior vesical artery. So let us name down what are these arteries. Artery number 3, 4, 5 and 6. What is artery number 3? That is called as your obturator artery. Obturator artery. Artery number 4 is your uterine artery. Artery number 5 and 6. 5 and 6, one is called as your vaginal artery and next one is called as your inferior vesical artery. Vaginal artery and inferior vesical artery. Okay, right. Apart from this, the next important branches which we can see over here is that it gives one branch. It gives one branch like this outside in this way. This is called as inferior rectal artery. Okay, so what is this artery? This is called as inferior rectal artery. Now after that it gives another branch like this. This is called as perineal artery. What is this? This is called as perineal artery. And next it gives the third branch in this way. This is called as, in males it is called posterior labial artery and in females it is called as, posterior scrotal artery and in females it is called as posterior labial artery. So this is called as posterior scrotal artery in males and it is called as posterior labial artery in case of females. Next we have got artery to the bulb of vestibule. Next artery is called as artery to the bulb of vestibule. Okay, so this is your artery to bulb of vestibule. Okay, so this is your artery to the bulb of your vestibule. Here, this is your artery to the bulb of your vestibule. And the last artery over here is called as your internal pudendal artery. Okay, this is called as your internal pudendal artery. Now, here, if you look here, coming to the posterior branch. So one branch over here is going on to the top from the posterior branch of what is this? What is B? Internal iliac artery. From the posterior branch of internal iliac artery, you see one branch that is going up into the lumbar region. This is called as iliolumbar artery. What is the name of this artery? This is iliolumbar artery. Okay. Now after this iliolumbar artery, you see two other branches. See, one branch that is supplying to the gluteal region down here. This is called as your superior gluteal artery. So this one over here is called superior gluteal artery. Okay. Next important thing is that there is one more branch that comes down all the way here, and this branch over here is called as your lateral sacral artery. Lateral sacral artery. This is called as your lateral sacral artery. Okay. Now there are two important ligaments over here. One is called as sacrospinous and another one is sacrotuberous. So this is SS, sacrospinous. This is ST, that is called as sacrotuberous ligament. Okay. Right. Now one very important anastomosis I want to tell it to you, that you see artery number 3 is called as your obturator artery. Now from the obturator artery you see a branch that is coming like this. And next, another important branch is the inferior epigastric artery. From the inferior epigastric artery also you see a branch that is coming down. So these two branches, they join like this. Okay, these two branches, they join like this, and here exactly you see an anastomosis that is formed. This anastomosis is called as corona mortis. What is the name of this anastomosis? This anastomosis is called as corona mortis. This is one of the very important anastomosis which you need to know, right? So these are all the branches of both the internal as well as the external iliac artery, guys. So thank you so much for watching my video. Goodbye.